Hello everyone, my name is Shirley Dennis. I'm doing my presentation on hospital acquired infections. So what is hospital acquired infection? Hospital acquired infection or infection patient get while receiving health care for another condition. For example, a patient might be admitted for something really simple and ending up having C. diff or UTI or pneumonia. What are some examples of hospital-acquired infection? UTI is very, very common, especially in older adults, and they start getting confused and agitated. Surgical site infection, patient post-op surgery, such as hip surgery or knee surgery, if they not changing the dressing regularly, it poses a great risk of having an infection in the wound surgical site. So you usually will see if the wound is infected, the nurse will see redness around the wound, swollen, sometimes purulent drainage. That's a good sign of surgical site infection. Gastroenteritis, meningitis, pneumonia, and C. diff. C. diff is also common, especially with patient on different type of antibiotics. Symptoms of hospital-acquired infection. Some examples are discharge from a wound, usually a purulent drainage, fever, cough, shortness of breath, burning with urination, or they have problem urinating. Um, you will see that in patients with UTIs, headache, nausea, vomiting, diarrhea is most common in patients with C. diff, and you can tell it's C. diff by the smell of the stool. It usually has a really foul odor, and the stool is very, very loose. Who is at risk for hospital acquired infection? Your hospital roommate. If if a patient is the roommate with another patient with an acquired hospital acquired infection, he or she is most likely get it. Older adults, prolonged use of antibiotics, um, it can result in C. diff. Urinary catheter, it's a big um, risk for UTI. Prolonged ICU stay, immunocompromised patient. How are hospital-acquired infection diagnosed? Um, Most healthcare provider can diagnose hospital-acquired infection just by looking at it, and also the symptoms, um, such as redness and warmth, rash, inflammation, high temperature um, at, at the site, and can also be an indication. How to prevent hospital-acquired infection? The number one um, prevention method is hand hygiene. Washing hands between patients, before you go in the patient room, and after you when you're coming out of a patient room, it's always crucial to wash your hand, especially C. diff patient. I've witnessed some people just use uh hand sanitizer, and it cannot get rid of the bacteria. You literally have to go and wash your hand with soap and water. Properly handle IV catheters, like change the IV tubing. Make sure you clean the site before you do anything, like flush with normal saline and stuff like that. Limit use of Foley catheter. Uh, get rid of it as soon as possible. Proper PPE use. Don't go in a isolation room without your PPE. Wipe stethoscope with alcohol pad between patients. That will help with prevent bacteria. Why is it a problem personally and nationally? Hospital-acquired infection creates suffering, and also it's very costly for the patient and the family members. It also prolongs a longer stay because if they end up having an infection, they have to stay longer at the hospital to get proper treatment. Create long-term disability, result in massive additional financial burden for healthcare systems. At my hospital, we get we pay if a patient comes in and ending up having a hospital acquired infection, we have to pay for that. So it costs the hospital a lot of money. It also causes emotional and physical stress on the patient because they want to go home. They don't want to be at the hospital for for a long time. And also it can lead to death if it's for example if if it's sepsis or something very very extra, it might lead to death. Treatment for hospital acquired infection. Treatment depend on the infection. If it's a bacterial infection, most doctors will likely order antibiotics. And if the patient has a polycap or any other foreign devices, the doctor might order to discontinue it as soon as possible.